Hello, my name is Dr. Bonnie Rogulj, and I am a licensed physical therapist and assistant professor in the Flex Doctor of Physical Therapy program at the University of St. Augustine for Health Sciences. For the 6th World Aging and Rejuvenation Conference, I will be presenting an e-poster titled Creating a Community Event to Promote Fall Prevention Among the Older Adult Population and Interdisciplinary Collaboration. The primary purpose of the e-presentation is to discuss the creation of a multidisciplinary community event incorporating the Center for Disease Control and Prevention's STEADY initiative to promote fall prevention among the older adult population, interdisciplinary collaboration, and advocacy opportunities. The Centers for Disease Control and Prevention is a national public health agency under the Department of Health and Human Services in the United States. For over 30 years, the CDC's National Center for Injury Prevention and Control, known commonly as the Injury Center, has focused on improving lives by stopping injuries and violence before they happen. The CDC's Injury Center created the STEADY initiative for healthcare providers who treat older adults who are at a risk of falling or who have fallen in the past. STEADY stands for Stopping Elderly Accidents, Deaths, and Injuries. According to the CDC, more than 1 out of 4 older adults aged 65 years and older fall annually, with a single fall having the potential to double the risk of falling again in the future. The CDC's website, titled Facts About Falls, provides compelling data related to falls among the older adult population to raise awareness that falls are serious and costly. A few facts on the website that are listed include, but are not limited to, annually, there are approximately 3 million visits to the emergency room department by older adults due to falls. About 1 million hospitalizations of older adults that are caused by falling occur annually as well. And nearly 319,000 of the hospitalizations are for hip fractures caused by falling. Falls are also the leading cause of traumatic brain injuries among older adults. Falls can occur as a result of multiple risk factors, both intrinsic and extrinsic risk factors. And the more risk factors that an individual has, the greater their chance of falling. Some examples of risk factors that may increase an older adult's fall risk are poor vision, lower extremity weakness, difficulty with walking and balance, improper use of an assistive device, poor footwear, polypharmacy, and environmental hazards such as uneven surfaces in the community or clutter and throw rugs in the home environment that can cause an older adult to trip and fall. For this reason, a multidisciplinary approach may be beneficial to address the complexity of the various modifiable risk factors that are identified as contributing to an older adult's fall risk. Creation of a community event to promote health and wellness specifically related to fall prevention among the older adult population provides an opportunity for healthcare providers from various disciplines to perform screening for early identification of older adults who present at an increased risk of falling. Furthermore, the participation by healthcare providers from various disciplines in a community fall prevention event may also provide additional benefits, such as an opportunity for interdisciplinary collaboration and advocacy for the needs of the older adult population. The STEADY initiative that was created by the Centers for Disease Control and Prevention's Injury Center offers a coordinated approach to implement the American and British Geriatric Society's clinical practice guidelines for fall prevention. The 2011 clinical practice guidelines by the American Geriatric Society recommend having an annual screening of older adults for risk of falling and preventing falls among those who are at an increased risk. And so based on these American Geriatric Society guidelines and recommendations for fall prevention, the STEADY initiative consists of 3 core elements: screening those at risk for falling, assessing modifiable risk factors, and intervening to reduce the risk by using effective clinical and community strategies. The study initiative also provides a collection of free resources that relate to older adult falls. So in September of 2023, I was able to create an interprofessional event that incorporated the CDC's study initiative to raise awareness of fall prevention among the older adult population in my community of Northern Florida. Development of the event began with sharing the idea of an interprofessional falls prevention awareness event with fellow professional colleagues and members of the interdisciplinary team. So in my dual roles as both a licensed physical therapist and a full-time higher education leader in a Flex Doctor of Physical Therapy program at the University of St. Augustine for Health Sciences, I was able to collaborate with graduate students, staff members, faculty members, as well as licensed professionals in various medical professions such as nursing, occupational therapy, pharmacy, and low vision. The event was scheduled at the St. Augustine University location, and this site was selected for reasons that include it was no cost, it was very accessible by interprofessional volunteers as well as the community older adult participants, and it was positioned in close proximity to nearby medical facilities. So based on the study initiative, the event incorporated multiple stations to address needs of the older adult population in our community. Station 1 was a check-in for participants to register, enter a raffle prize drawing, be able to complete required consent forms in order to participate in the event, and also be provided an event folder that was filled with multiple study resources. Station 2 was for participants to complete the study Stay Independent brochure. Station 3 was a vitals assessment, and so blood pressure performance, heart rate assessment, screening for orthostatic hypotension among participants. Stations 4, 5, and 6 had screening for mobility by using the timed up and go test for leg strength and endurance, using the 30-second chair stand test, and also the 4-stage balance test. And then finally, Station 7 had a vision assessment, Station 8 had medication review, and Station number 9 did an assessment of adaptive medical equipment and proper footwear. Station 10 was a checkout station for participants to be provided education related to their fall risk and also be provided community resources, including evidence-based programs that are available, local programs that they may need, such as Meals on Wheels, opportunities for participation in other health and wellness activities, such as attending physical and occupational therapy services, and also provided a nutritious snack for the participants. So on our poster presentation, you're able to see several of the stations that are set up. There's an image of the check-in station for registration. There's an image of participants who are at the vital station and they're performing blood pressure assessment. There's an image of the timed up and go test that is set up. And also there's an image of adaptive equipment for patients who wanted to be able to assess their equipment that they're using for safety. In conclusion, approximately 30 community dwelling older adults participated in the Interprofessional Falls Prevention Awareness event. The event provided an opportunity for collaboration among those participating graduate students, staff and faculty members, and the licensed professionals, including nursing, occupational therapist, pharmacist, a low vision specialist, physical therapist, and of course our older adult community dwelling participants. The participants were provided education related to fall risk based on the study screening and assessment findings, and offered interventions such as community resources, including evidence-based programs that are available, including Tai Chi and a Matter of Balance. Local programs were offered, such as Meals on Wheels, as well as opportunities for them to be able to promote health and wellness. Included on the e-poster presentation is a quote from an 80-year-old community resident and event participant named Pat. Pat reported, "This afternoon I learned a couple of new things like medication that may contribute to overall fall risk about my vision. I learned that my peripheral vision is better on my right side compared to my left side. Also, it's nice to come to a place in the community that has a comprehensive screening for falls and to be provided education. I got a lot out of this event." So overall, the interprofessional event that incorporated the CDC's study initiative to raise awareness of fall prevention among the older adult population was a success. I highly recommend the study initiative, and I encourage the participants of the 6th World Aging and Rejuvenation Conference to check out the free training and resources that are available on fall prevention to be able to put these strategies into your own practice and communities. I thank you for taking the time to listen to this presentation. Finally, resources are on the final slide, as well as a bio background. Thank you so much.